Moving on to the next, we have a new scene, and that is known as Peck and Peapods with Roma and Jones. Now, what does that mean? Peck. P stands for pain in chest, E for edema, and C for claudication. Then we get Peapods, P for palpitation, and then pods. P stands for P and D, O for orthopnea, and D for dyspnea, which is just exertional dyspnea. And we have pods, S stands for syncope. And besides that, also we have Roma and Jones. Roma is here to remind you of rheumatic fever, and Jones is the famous Jones criteria for that fever. So now let's really dive into the scene to see this show. We have a bodybuilder, and that is going to represent pain in chest because he's showing his pec muscles. If we talk about the chest pain, we can have a lot of causes. For example, angina, MI, psychogenic, non-specific, which is just called musculoskeletal pain. It could be pneumonia, pneumothorax, pericarditis, or PE. All you have to do is ask about the character. If it's crushing, pressure-like heaviness, that's because of angina or MI. If it's dull and pleuratic, that's because of pericarditis. If it's pricking, that's psychogenic. If it's burning, that is because of GERD. So it really depends upon the character of the pain. Next, you're going to ask about the radiation. If it's radiate to the neck, left shoulder, jaw, that's because of angina or MI. Or then you'll ask about the time. If it's less than 30 minutes, that's because of angina. If it's more than 30 minutes, that's MI. If it's just for a few seconds, that's because of cardiovascular. And if it's continuous for hours to days, that's because of pleurisy, pericarditis, or just musculoskeletal chest pain. What about aggravating factors? Well, you can ask if it gets worse with cough and respiration, that's because of pericarditis or pleurisy or just musculoskeletal pain. If it's just getting worse with the exertion, that's because of angina or MI. If there's discomfort on lying down, that is because of GERD or COPD or pancreatitis. And if there's pressure, that is because of musculoskeletal chest pain, pleurisy, or pericarditis. On a short note, just ask about onset, duration, intensity, progression, associated factors, relieving factors, aggravating factors, character, and radiation. Then you're going to ask about the relieving factors. The unstable angina and MI are not relieved with the rest. However, stable angina is just relieved with the rest. Oh my god, that's a lot of detail on chest pain. Now, what are the associated symptoms with the chest pain? You're going to ask in the patient. First things first, let's talk about fever. If there's a patient with a fever and chest pain, that's because of pneumonia, pericarditis, or just myocardial infarction. Wait a minute. This bodybuilder is with handcuffs? Really? Oh, that's there to remind you of cough. Now, that cough could be dry, could be blood stained, or just rusty or yellowish. Now, if there's dry cough with chest pain, that's because of pleurisy. If there's frothy sputum, that's because of left ventricular failure. If it's blood-stained cough, well, it has a lot of causes. For example, acute bronchitis, chronic bronchitis, lung carcinoma, ABPA, pulmonary tuberculosis. We get the pulmonary embolism, pulmonary AV malformation, bleeding disorders. We get the mitral stenosis. We get the small vessel vasculitis, for example, the good pasture syndrome. And there are a lot of causes for hemoptysis, but that's really not the case. We're just looking for blood-stained sputum with fever. So in this case, the cause is going to be pulmonary infarction. That's because of pulmonary embolism. Now, one more thing, if the color of sputum is yellowish or just rusty with a fever, that's because of pneumonia. Next, what else are you going to ask in a patient with a chest pain? Of course, you're going to ask about cold sweating. And this cold sweating is seen in MI, and if it's with fever, is seen in pneumonia. Now we're going to draw this policeman, and I understand why this bodybuilder is locked with handcuffs. It looks like the officer is just in a hurry, so this is going to represent the breathlessness, and he is also very anxious about his duty. So we draw anxiety symbol. It's chest pain with anxiety, that is because of cardiac neurosis, and if there's breathless with chest pain, that's really a non-specific symptom and could be associated with pneumonia, MI, pulmonary embolism, pneumothorax, or even cardiac neurosis. So just as a recap, in a patient with chest pain, you're going to ask about fever, cough, cold sweating, anxiety, and breathlessness. On to the next, we got this edema. And we're going to represent this edema with a big water tower in the back of the show. This big water tank is our symbol for edema. Now, to talk about edema or generalized swelling, we have a lot of causes. It could be transitive, it could be exudative. Now, if we talk about simply transitive causes, we get the liver, heart, and kidneys. For example, cirrhosis, we get the congestive heart failure or the nephrotic syndrome. If we talk about the exudative causes, we have myxedema or angioedema. And if you see a patient with edema, you're going to ask about the duration and onset. If it's a short history, that's because of angioedema. If it's long history and gradual, that's because of heart, kidney, liver, or just thyroid, which is myxedema. Now, if you see a patient with a generalized swelling, you're going to ask about the pattern. If it involves lower eyelids first and the patient complains of periorbital puffiness when he wakes up early in the morning, that's because of nephrotic syndrome. Next, if the generalized swelling starts from abdomen and then extends to the feet, that is because of cirrhosis. And if it starts from the feet and moves to the abdomen, that's because of congestive cardiac failure. If it's generalized, that is because of myxedema. If it involves eyelids, there's puffiness in the face, urticaria, itching, and there is formation of wheals, that is because of angioedema. Then you're going to ask about effect of posture and pressure. If it's increased by walking or standing or just hanging their legs down, that is just pitting edema. And the causes are heart, liver, or kidneys. And if there's no effect, that is because of non-pitting edema and could be because of myxedema or angioedema. Now that's a long lecture on edema. Why not we just dive into the lecture and see the associated symptoms, please? Okay, so first of all, we get here dog, an itching dog who is just itching so hard. And just beside that dog is a wheel, a cart wheel. So if edema or generalized swelling is related with itch and formation of wheels, and there's involvement of eyelids and there's puffiness of face, that's because of angioedema, my friends. Next up, we draw a little kid that was invited to the pet show as a chief guest. Joking. Anyway, we have this kid, and this kid is having urination along with discomfort in lumbar region. So if there's oliguria and discomfort in the lumbar region along with generalized swelling, that's because of nephrotic syndrome. Next, we have another bodybuilder of the pack show, and he's just lying flat on the stage, and that's because of orthopnea. Also, you'll notice that he's having features of breathlessness. So if there's breathlessness on exertion, orthopnea, PND, dyspnea, and the pain in right hypochondrium region, that is because of congestive cardiac failure. Now, sometimes along with these features, you get pain in the chest. So we have given this bodybuilder elastic bandage around his chest. And this elastic bandage is going to remind you of the chest pain. Next, we see what we have here. Oh, there's a beautiful thyroid bow. I think this belongs to the urinating kid. Hey, kid, when you're done peeing, just remember to take it back. Anyway, this thyroid bow is here to remind you of the hypothyroidism. And the patient is going to come with the generalized swelling, lethargy, sleepiness, intolerance to cold, hoarseness of voice, constipation, curly hairs, dizziness, and choking by their own tongue. Now, these are the symptoms of hypothyroidism, and you should keep it under your differential. Next up, we draw a cirrhotic tree that is going to tell you about the cirrhosis of liver that can also be a cause of generalized swelling or just edema. And along with this cirrhotic tree comes wheat crops. And these wheat crops are going to tell you about the celiac disease. So in celiac disease and other malabsorption syndrome, you lose proteins and you get edema, and this is pitting edema. And next up, just before we finish edema, you have to ask about aggravating factors. Does this swelling increase with the use of salt or drugs? If it increases with salt, that's because of CCF, cirrhosis, or nephrotic syndrome. Or if it increases with drugs, that's because of allergic angioedema. And not only this, you're also going to ask about the relieving factors. For example, diuretics, thyroxines, antihistamines, or steroids. And then you're finally going to ask about the progression. If it's getting worse, that's because of heart, kidney, liver, or just thyroid. Or if there are attacks, that's because of angioedema. Now let's move on to the claudication, also known as intermittent claudication, and for that we're going to draw another wrestler who is just having cramps or pain in his legs, just like claudication. Now this claudication really depends upon the condition of vessels, and you're going to ask a lot of things from the patient. For example, smoking, diabetes, hypertension, lipid levels or lifestyles, and normally the patient is going to present with a pain in the thigh or calf or hip. Now, in this whole scenario, you're going to ask some questions. For example, does it get worse with walking? Then you're going to ask about the claudication distance. See if the patient tells you they stop walking because of pain. Ask them how much time do they need to work again. Ask them if resting ameliorates their condition. Then just ask them how much they can walk again after taking rest. And finally, you're going to ask about their ability to walk. Now, there is a very important differential of this intermittent claudication, and that is neurogenic pain. Now, there are symptoms of lumbar spinal stenosis on one or both legs, and they're worsened by walking or standing, but they are relieved by bending waist and changing position. So, long story short, you're going to differentiate neurogenic pain from intermittent claudication, and claudication is strongly associated with cigarette smoking, diabetes, hypertension, bad lipid profile, and of course, bad lifestyle. Next up, we draw this cute little kid who is just palpating these pea pods. So this palpating kid is just going to represent about the palpitations. Now, what is palpitation? It is just the awareness of cardiac contraction. If we talk about the causes, it could be sinus tachy, exercysly, paroxysmal, atrial tachy, or just AFib or flutter. So while taking history, you must ask about the duration and frequency. If it's long-standing, on daily basis, that's because of sinus tachy. Then ask your patient what exactly is wrong with you. Yes, you have to ask about the exact complaint. Say missed beats, that's because of extrasystole. If they say heavy humping beats, that's because of sinus tachy. If they say racing hot, that's because of paroxysmal atrial tachy. If they say fluttering beats, that's because of AFib or A-flutter. Now it's time to turn into an inspector and find out the underlying aggravating cause. Ask them about anxiety, exercise, fever, smoking, strong tea, coffee, or anything that stimulates it. So we draw anxiety on this palpitating kid. Looks like this kid is anxious to touch these pea pods. Hey, you're just peeing around. I just complimented you and you're just peeing? Bad kid. Now for palpitation, if you get polyuria after palpitation, that is because of paroxysmal atrial tachycardia. That's a lot of urine. Bad kid. Then we draw another kid who just looks like his own brother, or maybe he's just a brother from another mother. Anyway, you see those baggy blue pants? That's because of pedal edema. Now, if you see a patient with swelling of feet, breathlessness, orthopnea, dyspnea, PND, that's because of congestive cardiac failure. And along with these blue baggy pants, he's wearing just what? Bro, these are for girls, not for you. Anyway, serious. Anyway, as far as my analytical skills are telling, this boy has a great spice and sense for the fashion. He's just wearing baggy blue pants along with a white bra. And this white bra is going to tell you about the central chest pain on exertion. That is because of ischemic heart disease. Moving on to the next symptom, we have syncope. So for it, we draw this syncope windmill. And why is that for? Don't ask me. I just don't know. All I know is this windmill is going to represent syncope. Thank you for your concerns. Now, what is syncope? It's just called fainting or sudden brief loss of consciousness. Now, if the patient is young, you can think about vasovagal or hysterical. Or if the patient is old, you can think about Stokes-Adams syndrome or TIA. If the patient faints within seconds, that's because of postural hypotension or carotid sinus syncope, or it's just bradycardia. And if the patient faints over a few minutes, that's because of hypoglycemia or it's just hysterical fainting. Now, it's very important to ask the patient if they just fainted while they were trying to stand from sitting position. That's because of orthostatic hypotension. Or they were not just changing their position, they were just sitting or standing. That's because of hypotension due to any other cause. could be carotid sinus syncope or syncope because of tachycardia. Next up, you're going to ask about the duration and frequency of the attacks. If it's brief, that's because of vagovagal or carotid syncope. If it lasts from few minutes to hours, that is because of hypoglycemia or hysterical. However, if there are many attacks over a period of days, that's because of arrhythmia or postural hypotension or just hysteria. Hurrah! Enough of this lecture. Just move on to the associated symptoms right away. Okay, so first symptom we're going to see with syncope is just palpitation. So we draw here a palpating kid. Next up, with this syncope mill, we're going to draw three different fire hydrants. The blue one, the yellow one, and the red one. Now the red one is for blood loss, the yellow one is for urine loss, and the blue one is just for fluid loss. Now, if there's excessive blood loss or fluid loss, this can cause postural hypotension and can precipitate syncope. While if there's syncope after micturition, this is called micturition syncope. Next, baby, we draw the owner of this syncope windmill. Here comes Mr. Syncopa with his horse. One thing you'll notice is that he's coughing. I mean straining. So straining or coughing, for example, in the patient with chronic bronchitis or children with the whooping cough can also precipitate syncope. So make sure to take a nice history on cough. And this is what we're going to discuss in our next pulmonary section. Next, you'll see that this horse has beautiful red colored armor plates on his neck. Yes, that is going to represent neck stiffness. Along with this horse is just wearing a headache cap. So this is going to represent about headache. So if there's a patient with a neck stiffness and headache and he comes with a complaint of syncope, that's because of cervical spondylosis. One more thing you'll notice in this horse is that along with neck ache and headache, he's also wearing a beautiful chest plate. Now this is going to tell you about different cardiac conditions that are associated with syncope. For example, in HOCM, which is hypertrophic obstructive cardiomyopathy, aortic stenosis, all these can precipitate syncope. And just before we get through this syncope, here is the last banger. Where is the jerk? Where is he? I think there is a wanted criminal who's just missing from the town and there are banners everywhere. Where is the jerk? Now, the jerk really means jerk. If there is syncope with the jerking movements and generalized spasms, without loss of consciousness, that's important, it's going to be hysterical fate. And you see those handcuffs along with that jerk on that banner? Well, that's there to remind you of cough. As I told earlier, that cough is also associated with syncope. For example, in chronic bronchitis or children with whooping cough, they can cough so hard and eventually they'll just faint away. And then finally, we're going to draw these ice flakes around the syncope windmill, which are going to tell you about cold sweating. So must ask about cold sweating in a patient with syncope. This carries great importance for vagovagal and hypoglycemic syncope. So to summarize, if you see a patient with a syncope, you must ask about chest pain on exertion, coughing, micturition, palpitation, headache, neck stiffness, cold sweating, fluid or blood loss, or jerk or spasm. And finally, we move on to Roma and Jones. Welcome to feminism, baby. Now you're going to propose a boy. So as you can see, our Roma is proposing Jones, and both look very happy. Now they are here to remind you of rheumatic heart disease. Roma for rheumatic and Jones for the Jones criteria. For example, you're going to ask about arthritis, which is migratory polyarthritis in this case. We're also going to discuss joint pains in our rheumatology section. O stands for heart, and in this case, it could be pancarditis. You'll just get these cardiac symptoms, which are just Peck and P pods with Roma and Jones. N stands for nodules. These are subcutaneous nodules. We'll discuss it in our dermatology section. E stands for erythema marginatum, and S stands for syndrome scoria. That was all about cardiology section. And just as a fresher, what do you say if we just revise these all symptoms? Maybe in just 5 or 7 seconds. Well, that's fine. I think it's fine. So to summarize, you're going to ask about pain in chest, edema, claudication, palpitation, orthopnea, PND and dyspnea, syncope, and Roma and Jones, which is Jones criteria for rheumatic disease that is typically followed by strep throat or just skin infections. One thing you might have noticed is we missed our pod, P-O-D. P stands for PND, O stands for orthopnea, and D stands for dyspnea. So we have right now missed these pod, and you know why? Well, that's because this pod is also shared by the respiratory system. So we're going to discuss PND, orthopnea, and dyspnea under the combined shadow of pulmonology and cardiology section. So that was all about CVS.